Doctors of Reddit, who has been your worst? But I looked it up on WebMD patient. In this day and age of the internet, I'm still surprised people don't use WebMD more. Just this week I was in our workroom when a senior physician sitting next to me was on the phone and suddenly grabbed my arm while desperately trying to keep a straight face. The senior physician was talking to a 24-year-old female patient and the conversation was going, "No ma'am. You can absolutely get pregnant, even if you don't orgasm. No ma'am. Just because he's feeling nauseated the morning after doesn't mean you're pregnant." I had the reverse happen. I went into my family doctor of 10 years with an extremely itchy arm with a rash. I work with suck animals and told the doctor I was positive that was either ringworm or scabies. They told me no, definitely not, and prescribed hydrocortisone for contact dermatitis and sent me back to work with the animals. 3 days later, it has the telltale ring of ringworm and is infected due to the hydrocortisone they prescribed. I went back in and asked why I didn't come sooner. I raged. Not only did I start an epidemic at work, since ringworm can be passed between species, and the doctor insisted it was simple skin irritation, but I still have an extremely visible scar known as post-inflammatory hyperpigmentation that can take up to 3 years to fade. My doctor said he could fix it with a $300 skin laser treatment. I found a new doctor. I had a woman come to see me because of abdominal pain. I spent a good 10 to 15 minutes of asking her questions to get a better understanding of what could be happening. I ended up ordering an ultrasound to assess for an ovarian cysts and some blood work. As she's leaving she goes, "Are you doing lab work for my prostate?" I had to bite my tongue so as not to laugh and said no, because you're not a male and you don't have one. She just said oh and left. Spoiler alert, she had an ovarian cyst. Like a couple people have posted, I've been on the opposite side of this, but I think it still fits. Back when I was a teenager I was a really big fan of human comics, and she posted a sad about a condition she was recently diagnosed with called polycystic ovary syndrome or POS, and listed the symptoms. Aside from the ones I couldn't account for like fertility problems, I had nearly all of them, the biggest one being I hadn't had my period in over a year. My parents took me to the doctor who immediately booked me for an ultrasound. Turns out I really did have it, and my doctor commended me for coming to him about it. I'm very thankful to Human for posting that sap. I never would have known otherwise that what I was experiencing wasn't normal. This will make my friend sound stupid, and she really isn't. When she had her first baby and was in that woozy /sleepless new mom phase, she took the baby for her checkup and completely misheard when the doctor told her the baby had eczema. She got home and started googling what she thought he had said and called me in a panic, saying, "The doctor said the baby has emphysema. Why? That infant never smoked a day in her life." I'm an RN in pediatric neurology. We frequently have families who refuse to put their kids on seizure medications regardless of the EEG findings and the fact that they, have seizures and stuff. One family did the research and attempted to cure the child's epilepsy with essential oils, over-the-counter CBD oil, yoga, metal iron wristbands to balance the brain. They even went as far as having the kid's dental fillings removed and replaced with a non-metallic filling. There was the time that someone told us she didn't need medication because if you opened a fizzy can of Pepsi and put it under her nose she would come out of a seizure. If that didn't work, you could whisper Reese's Pieces in her ear and she would stop seizing. My least favorite visits are from parents who refuse to believe that their kid is twitching because they have motor tics and likely Tourette's instead of epilepsy. Like, if it was a choice between Tourette's and epilepsy, you should choose Tourette's all day long. Why these parents are hell-bent on giving their kids a diagnosis of epilepsy is beyond me. I just don't even know anymore. Not a doctor, but when I was in middle school the internet led me to believe that it burned when I peed because I, who had not so much as held a girl's hand, had syphilis. Turned out I was just really dehydrated. RN. But my favorite was when a patient's family member rudely insisted we give her mother who had a major stroke, resulting in nearly zero swallowing capability, as much water as she could drink, because I read a study online that said you can't aspirate on water because your lungs just absorb it back into your bloodstream. I looked her dead in the eyes and said okay, then explained drowning to me. Veterinarian here. This is the worst I ever had, but not because they were wrong. A large lady wearing a muumuu brings a kitten into the clinic. She plops the kitten onto the examination table and says, "Pretty sure it's got ringworm." I examine the kitten, and sure enough, it has a couple of classical ringworm lesions. Too young to give oral antifungals to, so I prescribe a topical therapy for it. Large woman asks if that would work on human skin too. I say it should. She says good, because the reason she knew the kitten had ringworm was because she found a lesion on her own body that she looked up on Google, and it looked like ringworm. And before I can ask anything further, she flops out one large, saggy and obviously non-brassica supported tip through the neck of the muumuu to show me the ringworm lesion on the top of her left boob. Yes, that's a ringworm lesion on your pendulous breast. Now please put it away. As a twist, not a doctor, but I once went into the doctor for what turned out to be a less common skin virus. The doctor took one look and said, "Holy cow, I just read about this on the internet. Christmas tree rash." Just graduated medical school a few weeks ago. The most frustrating are the concerned parents who buy into all sorts of myths regarding vaccines. Especially frustrating are the parents who refuse the HPV vaccine for their daughters and sons, not based on any misguided health concerns, but instead due to beliefs that it will encourage their daughters to be sexually promiscuous when they are older. I have a spin on this topic. I had a searing pain through the left side of my chest. It was excruciating. It started as a dull pain, but quickly felt like my chest was on fire. I thought I might be having a heart attack, but I didn't die, and the pain kept building. While lying in bed attempting to sleep, and literally crying from pain, I googled my symptoms. My self-diagnosis, shingles. The next morning I went to the doctor, and told him what I thought the problem was. To my surprise, he opened a web browser, and went into exactly the same site I'd looked at the night before. And sure enough, shingles. We have a common newborn screen in Canada, done at 24H with routine belly check. It's a heel prick and tests for 25 conditions which are rare but all have proven and effective treatments that have more benefit before symptom onset: thyroid disorders, metabolic issues, cystic fibrosis. I had one parent refuse because it is eugenics, and they had refused genetic screening. They googled it. Dude, I get what you're saying, but no one is offering to abort your healthy, term-delivered infant who is now 24H old. We just want to make sure, if baby has a treatable, but not curable condition, that we can get you supports. Period. I felt sad that they had so much misinformation, that they feared for their child's life. No judgment, just sadness. Family physician here. It happens quite often actually. A patient swears the problem is something it isn't from something they saw online. But my worst case was when I recommended a vaccine and the kid's parent just had to be an anti-vaxxer and flipped out, spewing bullshit from her 30 seconds of research. I'm sorry this doesn't answer the question, but it's related, and I'll say upfront, my fiancée is a nurse and she and her nursing colleagues have all agreed I was well within my rights to be the asshole in this scenario. I'm usually extremely polite to everyone, but you know, pain. I went to the emergency department because I couldn't move anything above my waist and was in horrific agony. For no reason whatsoever my back stopped working. This was on Christmas Eve, and left it till the 28th to go into Tridge, and I'm waiting around for hours, still in pain, and trying to move in any way. Eventually Tridge nurse shows up. So, what's the problem? Back is in agony, can't move. I haven't injured it, think it's maybe a slip disc, or trapped nerve or something, I'm not sure. Are you a doctor? You're not, are you? So don't come in here trying to guess what it is. Okay. Are you a doctor? She stormed out without saying a word, and the doctor came in 5 minutes later, took a look, and determined some swelling had trapped a nerve, heavy duty diclofenac, and I cold danced 30 minutes later. Librarian here. Before WebMD/DR, Google it's a medical textbook called the Merck Manual. While intended for medical students/doctors, it quickly fell into the hands of decades of self-diagnosers. I once heard it described as hypochondriac's handbook since 1899. As a patient who looked up his odd symptoms online, never tell your doctor you looked up your symptoms online. Had odd reduction of feeling in my pinky, ringer, half my middle finger, along with that half of each hand. Also reduction of feeling from halfway down my thigh and below. Also Lermet's sign, check for spelling. Saw pretty dead on clues for transverse myelitis, lesion on the spine. Got sent to a neurologist who basically told me that I was feeling my symptoms because I sketched myself out searching online. Took me and my parents crawling up his ass to get an MRI scheduled. Lo and behold, a nice glaring lesion on my spine, C4 and C5. He told me he would learn to trust his patients more from then on. I'm not a doctor, but I did take my very elderly nana to the hospital after I showed up to her house and found her slurring her words and behaving very strange overall. Now, my nana is a major hypochondriac, and when she was admitted the first thing she told the doctor is that she believed she was experiencing the beginning signs of Parkinson's. It turned out that she had mixed up a bottle of non-alcoholic wine with a bottle of regular wine, had drank the entire bottle, and was completely hammered.